Welcome to the Fix Your Sciatica podcast, where we meet with experts and clients and discuss how to manage your sciatica and low back pain without the use of medications or surgery. I'm your host, Dr. Ashley Mack, and I'm a physical therapist as well as the founder of ifixyoursciatica.com, a go-to resource for pain management. When I meet with clients on a consultative basis, one of the first questions that I ask them is, have they worked with a physical therapist in the past? And the reason why I ask this is that as much of an expert as I am helping people with sciatica pain, there is an entirely large class of professionals called physical therapists who can actually help you. And there are two major categories of physical therapists when it comes to the payment standpoint. You have insurance and you have cash. And when I'm working with clients in California, clients are paying me out of pocket. I would be considered now a network provider. But when I work with folks outside of the California state, I work more as a consultant, helping people out. But there really is a huge value in working with someone in person. And in some cases, you want to be able to use your insurance. And there's this huge challenge between cash-based physical therapy and insurance-based physical therapy. And there's a lot of misinformation out there. And so today's episode, we're going to try to debunk a lot of those myths, but also help you understand how to navigate the insurance window, but then how to actually find a therapist who takes your insurance that can also provide you the care that you want and you deserve. So today I have Dr. Jonathan Zaid, physical therapist, clinical director over at Excel Physical Therapy in Hoboken, New Jersey. And he's a great friend of mine. I've been trying to, over the past year and a half, get Jonathan on an episode so we can talk about this subject because we share a lot of the similar views. And so, Jonathan, thank you so much for today, taking time out of your day to talk about this subject with me.
Thanks, Ashley. I appreciate being here. I'm looking forward to a great conversation. As you alluded to, we've been friends for, feels like, I think almost like 10 years now. And we've had a lot of ongoing conversations just about this type of model, essentially where the physical therapy business is when it comes to insurance-based versus cash-based versus, even just getting outside the box of how do we monitor patients when they're outside of our doors. So I'm looking forward to this conversation and seeing where it goes. But yeah, I'm happy to be on. And I know this has been a long time coming and I can't wait to talk about it.
Right on. Yeah, I can't wait, man. This is the time has finally come. So Jonathan, if you can, for our listeners, tell us a little bit more about yourself. What led you to being the clinical director at your clinic?
Yeah. So I've been a physical therapist for 10 years now. I graduated PT school. I had a job in my hometown, which it was good. I enjoyed seeing some of the people that, almost I grew up with, but I had, at that time, thirst for continuing education. So I found a job out in, I would call it, kind of more like Western Jersey, out in the Mount Olive, Morris County area. And the company that I started working with had continuing education essentially every weekend. So I could take a course. It felt like once a month. And so I was taking, SFMA, McKenzie, taping, dry needle, I took it all as, I tried to take as many courses as I could within that previous company because as a new grad, I just wanted to learn as much as I could. After a few years within that company of growing clinically, they wanted to invest in me. So we opened up a clinic in for that company. And it was in Parsippany, New Jersey. And it was a great, great experience. I had the opportunity to get my first managerial experience under my belt. There were some struggles, I would say, within managing that clinic. And throughout that time, from working in Mount Olive and then managing the facility in Parsippany, I always lived in Hoboken area outside of a brief stint where I lived in Parsippany, which, fortunately enough, I met my fiance while living out there. And so at that time, I knew I always wanted to kind of come back to Hoboken because, we belong to obviously the same gym. And I always had a, love for that community. So an opportunity within Excel opened up to take on a director role for one of their new clinics in Hoboken. So I interviewed for that position as the clinic director in Hoboken, and it was their first clinic outside of Bergen County. And luckily, at that time, I think that was about 4 years ago. So I was living in Hoboken for roughly 6 years outside of that brief stint that I mentioned. So I had a lot of friends. Obviously, I knew you very well in that area. So I figured, I can just start building up some relationships, let people know that I was in town if they had any physical therapy needs. So I interviewed with them, got the job, and then the rest is kind of history. My fiance and I moved back to Hoboken, and we've been back in this, Hudson County area for about 4 years now, maybe a little bit more, maybe like 4.5. But it's been great ever since.
What an awesome story, Jonathan. I think it's cool to be able to see that you transition from role to role based on what your gut told you and what really interested you, which I highly respect. That's actually one of the reasons why I'm doing what I'm doing, because what really interests me was helping people on a grander scale, creating a podcast like this. Listeners, what's also really interesting is that Jonathan is probably one of the strongest pound for pound people I've ever met. I remember seeing him at the gym, and I knew about him. We would go back and forth, but just seeing him load significant weight on the bar was really mind blowing. And so another big testament that lifting heavy weights is actually very good for you if done correctly. That's the caveat, right? Lifting heavy weights is great, but you have to do it correctly, so that way you get the maximal benefit. And so let's talk about insurance versus cash. There's a growing number of people who have some form of insurance. And I think a lot of people get very confused as to how to navigate that system when it comes to trying to establish care. So we'll start off on the broader lens, and tell us a little bit more about kind of walking us through that process of how to navigate the insurance so we can actually get care with someone like you.
Absolutely. Thanks for the compliment too. So when it comes to insurance, I like you mentioned, I think sometimes within our community of physical therapists, I think there's a lot of negative talk with it. The fortunate or unfortunate side, like patients want to use their insurance. So what that looks like is, so if you call our office, a lot of the times, and I'll just take a ballpark guess at the percentage of people that call and ask, hey, do you take my insurance? It's usually, I would say, probably around 70%. Some people are okay with, finding out after. But let's say you make a call to our office, or if you reach out to me and you ask me, hey, do you accept my insurance? The way that process looks like is we're in network with, I would say, majority, 90% of all major insurances. Maybe there's a plan or two that we don't accept, but I would say for the far majority, we accept all major plans: Blue Cross Blue Shield, Aetna, Oxford, United, Medicare. So you call our office, we will take some demographic information from you, date of birth, things of that nature, and we'll verify your insurance plan ahead of time. Everybody has a different plan, so I never want to give somebody financial responsibilities before they ever come into our office, because you might have a high deductible plan, so you might be responsible for anything anyways, and then or you have a great plan and you're responsible for $5 a session. So every plan is going to be a little different. So until we verify your insurance, we don't know what your financial responsibility will be before you come into our doors, or before we verify it. I should rephrase that. Now, before you come into our doors, we will call you and let you know, hey, you have a $3,000 deductible. Maybe you have a co-insurance. Each plan, it gets a little different. So it does require some education on what insurance plans are and what they look like. You might have a 30 visit limit. You might have visits based off of authorization. There are a lot of different nuances. So when you first call us, we will verify your insurance ahead of time before you know any responsibility.
We are going to take a quick break to tell you about our awesome new program called the Sciatica Protocol. If you don't have the time to see a professional, but are tired of trying to figure out this recovery on your own, then the Sciatica Protocol is for you. Harness the power of a knowledgeable physical therapist through your phone. It takes no more than 7 minutes per day, and it is designed to help you recover as quickly as possible. It is simple to start, and all you need to do is log into ifixyoursciatica.com/the-sciatica-protocol and fill out the 9-question quiz to begin. The link for the program is in today's show notes.
Yeah, that's really interesting. I've taken a deep dive into reading a little bit more about the current medical industry, which is the industry itself is very interesting. Just from a logistics standpoint. But I think one thing that you brought up which is great, which is this concept of insurance verification. I think one of the challenges, like in the past when I've worked in the insurance world, some of the patients that I worked with actually had no idea what their insurance covered. So as I was seeing this patient for visits upon visits, and it would be weeks to months, they end up getting a hit with a bill from us. And they're like, why do I have this? I thought my insurance was covering it. And looking back, I'm thinking, all right, in that scenario, that person might not have been told, either they weren't told of their insurance benefits, or they were told and then they forgot. And so, and then listeners, and correct me if I'm wrong, Jonathan, sometimes the insurance stuff kind of changes over a period of time. I know that we just started a new year as well. And so a great opportunity for people to actually get was reminded of what their benefits actually allow them or provide for them. When you're going through this process, right, this license verification process, I think one of the things that I've observed out here in California, specifically in Marin County, is the fact that the waiting time is about 2 to 3 weeks to actually even get started. So tell us a little bit more. Like I know that out here, when you take insurance, the volume is a little bit higher. And when the volume is a little bit higher, you're battling with, can you actually even work with a therapist? But even just the process of license verification, I know from myself, I'm calling my insurance, I'm on hold for like 40 to 50 minutes at a time just to get an answer to be like, I don't know. So tell us a little bit more about what that process is like or how long that process is, or what it could take.
Yeah, those are all great points. So I think I'll speak for the physical therapy side of healthcare when it comes to patient responsibility, and you mentioned surprise bills. With in-network physical therapy, you should be educated ahead of time. When you're in network with a insurance provider, you have a contracted rate. So let's say that's $100, $125, whatever your contracted rate with that insurance provider is the maximal responsibility that you will have. So when you're out of network, it gets a little trickier. So I've been part of like some out of network situations too. So let's say you're out of network with Aetna, which we're not, but let's just say you have this certain fee schedule where if you bill out 60%, you bill 60%, if you bill, patient might be responsible for 40% of the charges. Now that can get a little gray, as we know. That could be another conversation for like CPT codes and all that kind of stuff, but you might have a high responsibility. With an in-network insurance provider, you will only be responsible for whatever your contracted rate is. So let's just say, argument's sake, it's $100. If you see a physical therapist and you have a high deductible for 3 times a week, maybe let's just say 1 week, but maybe saw 5 sessions, you would be responsible for a max of $500. Now, that bill might come at the end, but that's something for your viewers and listeners to keep in mind too. So keep in mind in network versus out of network if you're looking for physical therapy providers, and ask the question, what is the max responsibility that I will have? So, you mentioned, asked too about wait times. I can't speak to other PT offices, but I'll say my specific office and the way I've always tried to operate is if a patient calls, I always try to get them in within 24 to 48 hours. So at least in New Jersey, or at least in the offices I've managed and overseen, we haven't had those type of wait times. I think that might be a scheduling type of I don't want to say error, but scheduling process that those clinics might have. For us, in all my offices, we try to see patients within 24 to 48 hours. So, and that might mean on the therapist side, coming a little early, staying a little later, or managing through certain time expectations. So I know this is something we might be getting into a little bit later, but from a scheduling standpoint, I schedule based on need, right? So I tell people expect about an hour for each appointment session, but I think we both, we know too, sometimes patients need 30 minutes, sometimes they need an hour and a half. I've had some patients who stay for 2 hours. So I give that expectation of like, we'll do an evaluation, we'll have a conversation about what your specific case might need, and then we can go into depth about time. And sometimes if a patient's like, hey, I need to see you tomorrow, my back is killing me, I have this pain going, speaking of sciatica, I have this huge, I have this pain going down my leg, I can't get out of bed. I'll say, come in and see me now. I might be a little bit short on time, but let's just at least, talk things through, do an evaluation, and try to see what we can do to get you feeling better right away.
Yeah. Listeners, if you couldn't tell, Jonathan and his clinic over in Hoboken, they really go above and beyond taking care of their patients. And out of all the clinics that actually take insurance, I think that they do a particularly good job of taking care of the patients and providing exactly what they need. And that's actually one thing, a very important quality that you should be looking in a physical therapist, or even someone who's taking care of you, is being able to be clear in regards to what you need and doing everything they can to help you, because we're all in the business of helping. And so we're going to go into a little bit more and talk about the qualities of a physical therapist and the insurance realm that you should be looking for. But as you heard, being able to see what type of information you're bringing to the table and presenting to you an organized plan. Now, granted that every plan sounds great, and we're going to be able to really act upon that plan, and there's going to be variables which actually requires us to make changes to our strategies. But ultimately, you and your therapist, or you and the person that you're working with, should be on the same page when it comes to expectations and what can get done. Which then actually allows us to go into the next question, Jonathan, is every physical therapist is kind of like a snowflake in regards to, we have like a base knowledge and a base way to address symptoms and taking care of people. Let's talk about the evaluation itself. I think what a lot of people, especially in the world where there's cash pay / out of network / insurance based, people don't really know what to expect during a physical therapy evaluation, especially when it comes to, say, a bigger clinic like yours. So what are some people, what can someone expect during an evaluation like this?
So I'll speak from my experience in the way I work with initial evaluation. So for me, I'm a big proponent of active listening. And so when you walk into my clinic and it's your first time in, so I'm going to get your whole story. I also don't believe in having my computer out while I'm listening to you. So I believe in eye contact. Tell me your story. What are you having difficulties with? What are your goals for physical therapy? So in the physical therapy terminology, I put a huge emphasis onto the subjective. So a lot of what I do in my initial evaluations is talking and listening, not me talking, but allowing the patient or client to talk and tell me their story, because that's going to lead me to my treatment. We've talked about in the past therapeutic alliance, right? Before you can get somebody to go through a treatment, you have to develop trust. And the way I believe that trust starts is through that first intake of what is going on? What are you having difficulty with? How long has this been going on? And some patients and clients, they'll talk for bless you for 30 minutes, right? And that's their time, that's their space to tell me their story, because before I go into maybe my thought process and treatment philosophy, I have to hear where you're coming from. So we've probably both have individuals that might tell you in 2 minutes, it's like, yeah, my back hurts and I can't get out of bed, what should we do, right? And so sometimes clients and patients tell you like that, or sometimes they tell you their long story. I had a patient just yesterday who had a long history of low back pain and just got out of surgery, and I haven't it's the first time meeting him, but he's had back pain for like 20 years. So that type of subjective evaluation took a longer amount of time because we were trying to do a deep dive into his history. So what to expect with a physical therapy evaluation is more active listening, but then start getting into, all right, so now what can we do to help? Where are maybe your range of motion limitations? Where might you have difficulty? If you're a lifter and you're having back pain, what does your squat look like? What does your deadlift look like? Do you have trouble hinging at your hips? So after we go through that subjective evaluation, we start going down the road of, what do you look like maybe functionally, but where might some of those joint restrictions or be at play, or, what is it that you want to do, right? So you and I both come from the CrossFit community. That's how we met. So if we're treating a CrossFitter and you're having back pain or some type of injury, how does this affect your lifts? How does this affect things at the gym? And how do we make movements? How do we do movements that look like that to get you back into the gym? So sometimes evaluations look a lot different. So for my CrossFit athletes, it might look different than, your runners, right? So if you're still going to look at your squat pattern, because I think that's important, but your treatment might look a lot different than, our CrossFit athletes. So it's making it specific, individualized, and customized to that patient, and then taking them through that plan. What does that plan look like? Is it best to see you once a week, twice a week? How severe is it? Are you going to be somebody who responds best to communication through an app? So everybody is a little different. I don't subscribe to every person needs to see me 3 times a week the rest of their life. It's hey, this is looking like you're in a good amount of pain. I'd recommend trying to come in twice this week. Or if it's something that you have a good handle on, I'm here as your coach and your mentor, or as your resource. So each plan is going to look a little different, and I think that's really what you should be looking for in a physical therapist, is somebody that's going to be aligned with your goals and help you to get back to do the things that you like, to empower you to move the way that you feel like you should. Because as we both know, back pain, sciatica, it's one of the most, it can be the most debilitating thing, and it weighs on our clients emotionally. So you should find somebody that understands also the psychological aspect of what this type of injury can do to you.
What an awesome evaluative process, Jonathan. I think, throughout this entire point, listeners, I think it's important for the person that you're working with to get as much information as possible. And to Jonathan's point, the act of doing active listening allows us clinicians to be able to get as much information as possible, not only to get the necessary information that we need to provide a treatment plan, but as Jonathan said, that therapeutic alliance. It's important that both you and the person that you're working with are on the same page when it comes to what you're trying to accomplish, but also being able to look into what are the limitations in your life that actually allow you or prevent you from actually following some sort of plan. Does your schedule, does your life, does your geographical location limit your ability to see a professional on a regular basis? Or do you only have 5 to 10 minutes a day to actually dedicate to yourself? And so our jobs as physical therapists and people who help manage your pain, we have to be able to create actionable plans for you, because you can feel amazing upon leaving our sessions, But if you don't have the opportunity to practice what we've discussed in our sessions, you're going to come back saying, I felt great at our last session, but then in between, I felt horrible. And that is only going to prolong your recovery. And it's going to just make things a little bit more miserable. And so I love the fact that Jonathan said that it's important that your clinician and the person you're working with is listening to you. I like to think about it, and Jonathan did a really great job, was just asking a whole bunch of questions. And those questions continues to, one, it builds a good solid relationship. And there's research saying that if you have a good relationship with your therapist, the person that you're working with, you actually have better outcomes because you will truly, in fact, feel more, I guess we'd say, like bought in or believe in the treatment plan. And that's a very big component to evidence-based practice, which is a very important concept, which evidence-based practice is a Venn diagram of three circles. Yep. We have patient beliefs, clinician beliefs, and then we have the research. And evidence-based practice is actually going to be the intersection of all those three. And a really important thing is making sure that you feel like you are heard and that your therapist and the person that you're working with truly understands you. And so, Jonathan, we went through, sorry, go ahead.
No, I was just agreeing with you. I think those are all great. Those are all great points.
Right on. Yeah. And so we have this evaluative process, a lot of questioning, a lot of getting into trying to understand the problem. And so from there, it's like, let's go into the treatment sessions, right? As you said, it can vary. It can either be once a week, it could be 2 or 3 times a week, depending on what that patient needs. So tell us a little bit more about what you can expect in a treatment session instead, like, which is different than the evaluation itself.
Yeah. So within a treatment session, I think it all depends on what you find, right? I think in PT, we've heard this saying a lot. It depends. So if you're having, I know like we talk a lot about sciatica, so I'll stay on that, I guess, diagnosis. And let's say if you're having sciatica or if you're having low back pain, what you can expect from the actual treatment side, at least working with me, is if we're finding what's called a directional preference. So that's usually where I like to start, with a lot of my back pain patients. Now, if we talk about McKenzie and like that treatment philosophy, it's not so, like, I don't believe in like you have to do press ups the rest of your life and like that's what's going to solve all your back pain. But if you're having this inflamed, irritated disc or sciatic like nerve symptoms, I think it's a good place to start to, as one of my friends coined it, put out the fire. One of like my PT buddies always used to talk about utilizing the McKenzie method of just putting out the fire and, going from there. So what that means is if you're somebody who has a little back pain and you're having a lot of irritation and what's called peripheralization of your symptoms into flexion, meaning the more you flex your spine, the more that nerve pain starts to go down your leg. We start to evaluate how much force you can tolerate going into the opposite direction and see if that nerve symptom starts to centralize, meaning does it go up out of your leg and into your back? So that's usually where I like to start too, is evaluating, do you have a directional preference? And that's not always the case because, in the McKenzie world, you might have what's called, they classify as a derangement. We could just use disc herniation as like a good, type of term. So if you're having a disc herniation, you're responding well to extension, I might explore that a little bit more with some manual therapy techniques. Now, I utilize manual therapy as a way to desensitize that area. So part of your treatment, you might expect some manual therapy. Me personally, I like joint mobilizations, some traction of the hips, nerve gliding. If it's a really like irritated area, I'll utilize some soft tissue work. So that's some expectations. It's not, you might not get manual therapy all the times because I think in our physical therapy world, I think there's a lot of schools of thought. I still utilize manual therapy a lot, but I think sometimes patients might not be really even ready for manual therapy if they're like they have like a really irritated disc and they're having trouble even kind of like laying down on the table. Manual therapy might not be the best move at that particular time. active movements that provide relief could be. But I would expect for majority of the time to have some sort of manual therapy, because I think you were alluding to before, just even talking about therapeutic alliance, that just develops a better human connection, I think, in my opinion. So you can expect that. If you're, maybe very active and you don't have this disc that's like killing you where you can't like sit, we'll probably get into some higher level exercises: squatting, deadlifting, single leg, lunging. A lot like I would say a lot of my patients don't like me because I have them do a lot of split squats. So but I think getting into a lot of those single leg movement patterns are really beneficial in order to elicit strength gains, because at the end of the day, I think you have to be strong. I think my bias, and I know it's a bias, but is strength training for all of our low back pain patients, because you want to develop resiliency for this. I don't think we can truly prevent injury, but I think we can minimize it through being as strong as we possibly can. I think there's like a lot of research out there of like reducing injury, but can you fully prevent an injury? I don't know. I'll say, me personally, I would probably say no. I think there are a lot of factors that go into injury and pain. We've talked about sleep, right? A whole different, area, nutrition. What's your previous level of activity? I mean, that's a long list that we can always go into, but I think in a treatment session, sorry, off tangent, but in a treatment session, you can expect some form of strength training within your session too.
Right on. I 100% agree with you. It's important for us to be strong, because the stronger we are, the more that we can do. I mean, strength itself is the ability to produce force, and force is going to produce movement. It's going to resist movement. It's also going to facilitate movement. And a large part of the people that I see is that not only are we experiencing some sort of traumatic event, which may have set off the irritation of the sciatic nerve, but it could also have been the fact that there was a lack of strength or an improper use of strength in itself. And so it seems like during the treatment session, when working with people like you, we're looking at actually providing some sort of intervention, some sort of action. And I love the fact that you're really basing what you're providing for sure on your treatment background, but also what the client needs. And the client's needs will be communicated through how the client actually speaks with you, but also based on your findings that you would find in the evaluation. But also, listeners, what Jonathan also has kind of talked about, but not has explicitly said, but everything that happens in the treatment session is also really good information for him to be able to make the decision on the next stages. And I love the fact that you look into other aspects of life, sleep, stress management, and all that other things, because what we've learned over the years, and even in the 10 years that both Jonathan and I have practiced, we've noticed that over the years, it moved from not just biomechanics, not just strength, but how your environment, how your world actually interacts with you. And so I'm really glad, because not too many people actually do that. And one of the major reasons as to why I had Jonathan on this call is the fact that we share a lot of the similar views, and it's always really great to be able to talk about it more in detail, especially from a different perspective, but from like a very similar viewpoint. So let's talk about like one of the biggest elephants in the room when it comes to insurance-based physical therapy. I know that when I'm out here in California, and also when I lived in New Jersey, I would be out of network for most patients. And so what that means for them would be that they would pay out of pocket to me. And even at the beginning of my career, I truly believe that if you have insurance, you can absolutely use it. There's no harm in doing it. In fact, I have health insurance myself, so I use it. And so from there, what I've noticed is that I was kind of like the last resort of people, kind of the last resort physical therapists people would go to, because they have exhausted all of their benefits through insurance. And one of the biggest feedbacks that I would get, they were like, Ashley, I was one of 4 patients in the room, and the therapist wasn't really paying attention to me, or I kind of got passed off. And That's an unfortunate thing, but in some cases, yeah, you may be in a room and you might not be the only patient. So I think one of the big things is in situations like that, right?
Yeah.
In situations like that, how can someone actually get the most out of their session if that does happen? It happens on occasion, and it would be naive to say that never happens. But I think it's important to be able to say, in these scenarios, how can we actually maximize the benefit of that situation?
Yeah, this is a great question. I think this is a huge debate that we see really within our profession. And I think it obviously affects our patients and clients a lot. So I don't subscribe to, I think you should have, 4 patients an hour the whole day, right? But I do think there are going to be pockets sometimes where that one person comes in 20 minutes late, another person comes in 20 minutes early, somebody forgot about their appointment, and before you know it, you have 4 people going at once. So the way I manage that, and the way I think your listeners and viewers can look at that too, is having open dialogue with your provider. So, for instance, I do at times throughout my day see 3 or 4 people at a time, but I always try to do my best. I'm not perfect with this. I try to do my best to communicate that with patients, because in the service-based industry, as you know, we are sometimes at the discretion of like when our patients can come in, right? That might be before work or after work. And that 7 a.m. time slot and that 5:30 time slot in my career have always been the 2 busiest times for when people want to come in. So when we schedule patients, and if somebody is like, hey, I really need to get in, I'd love to see you, can I come in at 5:30? I'll have that dialogue with that potential patient and client and say, listen, it's going to be a little bit busier here. I'm fine with it if you are. The way I manage that personally is I try to turn my clinic almost as into like a friendly environment, almost as if you're going to like the neighborhood bar or the neighborhood gym, where you don't want to have like this overstressed environment. I had a manager once, or a coworker tell me once in the past, when you think of going to like a busy restaurant or, that place you always wanted to go to, but nobody pays attention to, you're going to be frustrated too. So the way I manage that is we have a little bit more of an open gym setup. So I communicate on the front end saying like, it might be a little bit busier at this time. You might get some individuals who are uncomfortable with it, but I found that the majority of people are very just thankful that you're able to get them in at the times that they want. So communicate first, but also as a therapist, it's important to make sure you're paying attention to what's most important. And that means keeping your eyes up, right? And keeping your eyes up, looking around the room. If your patients are on the table, or if you're kind of doing almost like we can call this almost like a group class, right? Where you're having one patient at the cable column, another patient working on lunges. You can still stand right next to both and give appropriate feedback to both at the same exact time. So I think that's something for therapists to know. And I think for patients and clients to know, I'm somebody that likes that kind of feedback back. So if you feel like you're coming in at a time that you need more individualized attention, I think that's very appropriate to tell your therapist. I do see patients one-on-one. I do make sure that I block out enough time for, I do have patients who require more manual therapy, and I do have patients who require more education. So I think it's appropriate to tell your therapist that you feel like you need more alone time to get that education and that best service. Now, the caveat to that too is then you might not get the best times that you want, because scheduling might be more of a challenge. But to handle it, I would say first communicate and just have an open dialogue. And me personally, I don't take like offense to these things, because I think it's the patient's right to want to have the best experience. So I would say that's probably the best way to handle it. I think as a therapist, me personally, is just stay calm, enjoy the situation. Be grateful that somebody wants to entrust you in their care, and try not to get flustered in the minutia details of everything. Because a lot of times patients come in with a great attitude, and I'd say 99.9% of the time, it always tends to work out.
I love that, Jonathan. I think the big thing that you talked about, and this is one of the things that I communicate with the clients that I work with, and then even when they're going to a physical therapist, is communicating with the person, with their therapist, with the person that they're working with. So then that way they can truly be able to voice their needs and truly receive that. And it could be in a group setting, it could be in a private setting as well. I think another big challenge with all this is the fact that we're all just people. Like we are the folks who are rendering the services, the care, and we only have one brain, and we have one brain, only one body, and so the reality is that there are going to be scenarios where and then, like, when you're one of a couple of patients in the room, where you might not have the whole attention itself. Like I often would tell my patients, I'm not a rep counter. I'm not a person who will count every single repetition of yours. I need to be able to get an understanding. Are you doing things right? And so in some cases, being able to see if there's something needs to be fixed, but then also give you the opportunity to do these things on your own. Because the reality is that, and I've said this before, is that the 1 hour of treatment that you go to is only 4% of a 24-hour day. So if you're going to physical therapy once or twice a week, you're experiencing care for less than 1% of a whole week. And which means that we are going to be setting you up in a position to be strong, confident, and have the tools to actually help you recover. But also, when you go to these sessions, like, we're there to be able to answer any of the issues or address any of the challenges that you're going through. And I love the fact that you said, if you need more, let the patient, let the clinician know. As much as we hope that we could read someone's mind, we can't. And it is important for us to know. And that's also very important when it comes to pain management. When you're dealing with surgeries, there is somewhat of a protocol that is usually consistent based on each medical procedure, whether it be like hip or knee replacements. When you're experiencing pain like sciatica, we're doing a little bit more problem solving, because the pain that you're experiencing is not going to be standard across the board. And so it's important for us clinicians to be able to listen and understand, but the best way that we can get that information is when you communicate it with us. And so I really appreciate that, Jonathan. And I know that there was a huge misconception on what that experience is like. In some cases, in some cases, clinics might have a hard time trying to manage all those patients, but it seems like to you do a very good job of being able to manage when there's a fair amount of people coming in. And it's not like you're deliberately scheduling people at that time. It's just the circumstances, what happens, especially you're out in Hoboken, New Jersey. So people either go right before work or they go right after, and you have some pretty long hours. So major kudos to you, Jonathan, and that. Which then brings us to the next question when it comes to, all right, if people want to use insurance, which again, I am a total fan of. Actually, again, the first couple of questions that I asked after figuring out the person's story is, have they tried physical therapy? And then the role of insurance starts to kind of come into the conversation. For the folks who want to go and use their insurance to take care and manage their pain, what are some qualities in a clinician or clinic that they should be looking for so they can get the best outcomes?
That's a great question. So I think that what your listeners should be looking for is somebody who is aligned with, I would say, you and your personality, right? I would say, for instance, like, there are a lot, we'll use CrossFit, right? I could tell you, and this is also learning a lot from you, learning from you and like how to do kips, how to do kip and pull-ups, how to do gymnastics, how to snatch, right? So I think that it's important, if you're somebody who has a specific goal or activity that you want to get back to, is finding a therapist that aligns well with the activities you love. CrossFit for us. And so I think that there's that model. There's running. There are some really great running physical therapists out there who I can help you if you're a recreational runner. But I know that there are a lot of great running therapists out there who can really get down to the cadence, your heel strike, what type of shoes you wear. Those are things I have familiarity with, but I know there are a lot of good specialists out there. So I think that finding a therapist who aligns best with your goals is a great start too. Finding a clinic that you feel like you would actually have a good time at. I mean, that's something that I try to elicit in my staff, in my clinic, is I want everybody to have a good time. Everybody should be addressed by their first name when they walk in. There's that quote where everybody has the same favorite word, and that's their own name, right? And so I think making sure that you address everybody by name and that you get into their family history, in the sense of, what they do this weekend. You should feel like you're part of, a good group, and you should feel valued every time you come into the door, because I think we've both heard the horror stories of, as far as like clinics where, they sent me to a table. I just kind of sat there. Nobody, talked to me, and somebody just gave me, a bunch of exercises to do. I don't believe in that in the slightest. And every time you come into like our doors, that you should be valued, and that your experience should be valued, because your time is your most precious, commodity. So I want to make sure that if you're spending your time with us, that you don't feel like it's a waste of time. And that comes with, customer experience and patient satisfaction. So what you should be looking for is a therapist who listens to you, a therapist who is aligned with your goals, but also a clinic or gym, wherever you decide, where you can actually feel like you're going to have a great session, and that your time is going to be worth the value.
Amen to that, brother. Yeah, 100% agree. Whether you're going through insurance or not, being able to have someone who truly cares about you is extremely important. And I'm so thankful that there's clinicians like you in the insurance space who can actually serve folks who want to use their insurance. I think that there's a need for that, and I really appreciate that. And so and what's kind of like one of our closer to last questions is like, okay, now people are like, okay, I think I want to use insurance. There's so many clinics. There's a lot of clinics in the area. I know out here in Marin County, there's a ton. Like there's a street, and I remember in Hoboken when I lived there. You look at downtown Hoboken, there's like 4 clinics on the city block, right? And so, how does one choose? I think it kind of piggybacks off of the last question I asked you, which is like the qualities that you're looking for. But there are so many, right? So what is the process, or what do you recommend for folks who are like, I want to use insurance. There's so many clinics, I don't know where to start. Where should they begin? Yeah,
that's another great question, because I know in Hoboken there's one block that I'm specifically thinking of that has 4 clinics in one block. So like you mentioned, so that when trying to find your right physical therapist, or finding a physical therapist that aligns well with you, I would personally go to that clinic. I can't tell you how many potential patients will walk through our door and just tell us, hey, just wanted to check you out. I wanted to meet you first and see how you can help. I think that's like the best way, is to go out and meet, because this isn't to downplay Google reviews or anything along those lines. But if you go on Google reviews, I think it's a good first step. And ZocDoc, I think those are all great resources to first vet your therapist. So go on Google, go on ZocDoc, vet that potential physical therapist that you might want to potentially work with. But also keep in mind that a lot of these clinics, everyone's got 5-star reviews. So that's a good first starting point. When you see, all right, so-and-so has 5-star reviews, 5-star reviews. I think that's a great starting point. But I wouldn't put all my emphasis into just that. I would go and talk to that potential physical therapist and see if you have a connection with them. See if you're like, I could see myself trusting you. I think in our world of physical therapy, there's that talk of like sales. It sounds negative, but I look at it as sales in this type of fashion as, let me just see if we're the right fit. So answer your questions. And sometimes I might not be the right fit. I might not be the right fit for everybody, but I think what all of your what your listeners should look for is, all right, I want to go to this place. It's close to my house. Let me go there first to see if this is a good fit. Because two, some of these clinics that are all on the same street, they might not have the equipment needs that you need. So if you're a weightlifter, make sure that they have a lot of weights. If you're a runner, make sure they have the adequate equipment to assess your ability to run. If you're gymnast, dancer, if you do yoga, make sure that the therapist that you're about to work with has experience in treating somebody who does a lot of yoga. I think the best thing to do would be to go there first. And two, the benefit sometimes of using insurance is you can go to this provider, go for a treatment session and see if they're even the right fit. And if not, then, there's physical therapy is, in some instances, very saturated. So you can just go across the street and see if that therapist is better for you. So it's also okay to go through the evaluation process first, because sometimes it takes, a full hour to see if you're gonna vibe well with that potential client and therapist. So I would start there.
Yeah, really great actionable steps, Jonathan. I really appreciate your time because I know that you're busy running a major clinic in New Jersey. For the listeners out there who happen to be in New Jersey or in the Hudson Valley area and are like, oh my gosh, I think Jonathan is and the clinic over at Excel is exactly what I need. What's the best way to get in touch, or what's the best way to book an appointment over with you?
So the best way to get in touch with me, I would say, is through Instagram, for your listeners, or LinkedIn, social media. So I'm Jonathan Zaid.dpt. So if somebody has any questions, they can reach out to me there. If you live in the Hoboken or Jersey City area, we're in Uptown Hoboken, and you can reach out to us there. So it's Excel Physical Therapy, as you mentioned. And yeah, be happy to answer any questions that your listeners might have.
Awesome. Fun fact, Jonathan's clinic was actually 2 blocks away from the gym that I used to own in Uptown Hoboken. Yeah. And so, really, really thankful, really appreciative of Jonathan's expertise and knowledge and friendship and time. So thank you, Jonathan, so much for this. I'm really excited for these listeners to just get a better understanding on the insurance world and what it's like and how they can take advantage of it. So thank you for your time, listeners. Jonathan's contact information will actually be found in the show notes today. So if you have any questions, feel free to hit him up.
Thanks, Ashley. I appreciate you having me on. I know this has been a long time coming. It's a great conversation, and I appreciate your time. I know you're a busy man as well, and I love what you're doing here, and you're on a good mission.
Thanks, brother. Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day.
No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.